Connections with patients happen every single day.
It's your ability to have that connection and to be the person that they developed trust with.
It was an older lady. She had recently had surgery, and she had been in the hospital for 5 days, hadn't showered, hadn't been cleaned up, and was just feeling really yucky. I just spent the time and gave her a bed bath and washed her hair, conditioned it, brushed it. And her daughter, when I was done, pulled me aside and just told me how grateful she and her mom were, and that her mom felt as though I was treating her the way that I would my mom.
So there was a woman who had come in with her 2-year-old son, and they were in our frontline area, and she was so sweet, and I was just talking to her about, I remember when my kids were that young and how challenging it can be when they're sick. Her son was just challenging. He was fussy, he was crying, and I, kept supporting her and, did the things that I needed to do for his care. And then she left before completing the care, and I thought, wow, I thought we had really made this connection. It was really strange, but a part of me just knew she didn't quite understand the severity of her kid's illness. My nurse feelers kind of attached to that, and thought, well, we probably should give her a call and see why she left. And she ended up bringing her son back, and he had decompensated further and ended up needing to be admitted to the PICU. It's one of those things where it's like, if you have to take the time to connect with all your patients. Even if you think that the connection's not worthwhile, it is, because I really do believe that she came back because I took the time to see her as a person.
One of the pediatrics patients, it was time for her to go to, I believe it was preschool or kindergarten, so she had to get her first shots. And so she was just hysterical. Everything came together, and I had that time to give her. Playing games with her, ask her what her favorite things are, tell her how much fun she's gonna have in school. She let me give her the shot. And then she gave me the biggest hug, which was bringing tears to my eyes, and it was like, oh my goodness moment. And every time after that she came to the clinic for an appointment, she was like, hi nurse. And it's just those moments that just make me just wanna just wake up every morning.
Little boy, he got to an age where he just didn't like the feeling of the medicine. So we worked out a plan. We told him, showed him some things, what that would look like. He was in agreement, super excited. I agreed to go back into the OR with him. He did his breathing, fell asleep, did great. When he woke up, he goes, I did it, and was so proud of himself for making it through that. And I was proud of him, and we celebrated that with him. And he never needed the medicine falling asleep after that.
Probably 5 years ago, I was a nurse in the ICU, and I was pregnant with one of my daughters, and I was there for a family and a patient as she was a young girl, and we were talking about maybe donating organs. She wasn't going to make it. Being a part of that whole journey with that family, I just felt like it was the right place to be. I cried with them, I laughed with them. It was just very special. I just felt like they really trusted me and how I cared for their daughter. And knowing that I had a daughter on the way, I just hoped that one day someone would care for my daughter like that too.
There was a patient that we used to see all the time. She was very, very tiny, and I was at Walmart one day and I just saw her in line, and she was just thriving. She was looking so much better, and I just remember thinking to myself, this is why we haven't seen her in the hospital in a while, because she's actually doing good. And so things like that, just little things like that, just make me feel really, really good about my career choice and the things that I do, even when I don't necessarily realize that I may have made a difference.
We had a patient that was hospitalized for almost a year, and we got to know her very closely. She almost became like our aunt. We would take her clothes home and wash it for her. We would take her around for a walk with her wheelchair, and she was looking for a lot of support from us. She didn't have any family members coming, so that patient stands out a lot to me, and she comes across my mind.
Recently, I was able to go to the Philippines on a medical mission trip where we did surgeries for cleft lip and cleft palate. As a nurse, I was able to provide this care for patients that do not have access to the health care we have, and just seeing such a life-changing transformation with one surgery was truly inspiring.
I have patients that will call me, or when they come in for their postpartum appointment, they'll want to give me a hug or thank me for making them feel comfortable and safe during their pregnancy.
I regularly get from the patients how grateful they are that they have somebody who's talking them through this and explaining things. And that always, of course, makes me feel good and makes me want to continue to do that.
It doesn't always happen, but it's a great pause for me as a nurse to just remember why I'm in it and why I'm here and why I do the best I can absolutely every day.